This is Dr. Caudill Miller, Dr. Miller's Guide in Neurology. We're talking about problems you see in a private practice in neurology. Today we're going to talk about tinnitus. Tinnitus, or ringing in the ears. Oh my goodness. If I get a consult for tinnitus, I just cringe because I almost can never make it go away. Tinnitus is the hearing of a sound when no sound is present, and the sound can be ringing or clicking or hissing or roaring. I've had probably 5 patients that it sounded like crickets. Oh my gosh, it just drove them crazy. You see it in 10 to 15% of people, and a significant 1 to 2%. You know, I'm a hunter and used to do a lot of bird hunting when I was younger, still do some, but one of my bird hunts, I went in the morning and I forgot my earplugs, and I was put right in the center of a small 5-acre field, and man, those dove were coming in there like crazy, and I can't, at that time really young, I couldn't hit the broadside of a barn. I was shooting like crazy with no earplugs, and my ears have rung ever since. There's nothing that I can do to make them go away. I actually sleep with a sound machine and even have an app on my phone if I forget it to muffle the sound. So noise-induced hearing loss is very common, like what I have. You can get it from ear infections. You can get it from heart disease, Meniere's disease, which is a real tough problem. Brain tumors. Don't diagnose a lot of brain tumors. The first time I see people with tinnitus, the first patient I ever saw in private practice with tinnitus had a acoustic neuroma. You can see it with stress and medication. Some medications cause tinnitus, and you can see it with head injury and earwax. So we generally, refer them to ENT for an ENG and audiogram and a full ENT workup, and do an MRI of the brain with them that contrast with cerebellar pontine angle cuts to look for an acoustic neuroma or a cerebellar angular tumor. Do CBC, chem profile, thyroid screen. In the old days, we checked up patients for syphilis. We rarely have to do that in young people, except in certain areas when their syphilis has come back. There's just no good treatment medical options. So sound generators like the Sleep Sound Machine by Marcap, you buy on Amazon. Some people wear hearing aids. Some people have found melatonin with lipoflavonoid at bedtime helps. But I just use a sound app. So tinnitus is a tough problem. The ENT guys just hate tinnitus because it's hard to fix. So that's tinnitus. Like, comment, subscribe. More later.